Experts in Business, 620 AM, KEXB.
All right, welcome back. 3:15 on this beautiful Thursday afternoon. Coming up next hour, Dallas's largest office party. I want an invitation to that. We'll talk about that at 4:45. I want to bring in our first guest, Dr. Al Johnson of Johnson Medical Associates, based right here in Richardson. Welcome to the show, my friend.
Thank you. My pleasure.
Well, thanks for coming in. I enjoyed talking to you guys before the show. We have an amazing story of a young man involved in a traffic accident. Darn nearly took his life. Suffered substantial brain injuries, and through the help of you and some medical technologies, he is sitting with me today. Amazing.
It is amazing. Exactly. Michael's mom was looking at how to help him after he sustained a very bad traumatic brain injury. He was in a coma, I believe, for 9 months.
9 months in a coma.
And this was down in Florida, where he was living at the time. They almost took him off of life support. Thank goodness he blinked his eyes on day 9. They were going to take him off on day 10. And he'd been through rehab and just kind of got stymied in his whole process. That's all the better he was going to get, what they told him. And his mom started looking around at what else to do for him. How else can I help my son to get some improvement? She did research and came across Hyperbaric and found my facility, which is located in Richardson, and called me up and said, can you help my son? And I said, well, I'll be happy to take a look at him, see what we can do. There's good literature substantiating improvement in this type of injury, traumatic brain injury, where hyperbaric treatment rehabs those cells that have been injured, helps them heal. And sure enough, he's here today, just got married,
Nice.
Has his own social media site. So it's a great recovery on Michael's part.
Yeah. Michael and Kara Black joining us on the show. Let's talk about that day. Accident, single car accident that you were involved with.
I really don't remember it, but I think I overcorrected and hit the median and rolled my SUV 9 times.
9 times.
I was ejected from the vehicle and landed on my head. That's how I suffered a traumatic brain injury.
And then it wasn't for, I guess, an eyewitness that called it in to 911.
Yes. Tom Perez, the first responder, showed up. They picked me, scraped me off the ground, put me in the ambulance, and took me to the Orlando Regional Medical Center, and he happened to drop me off, and his wife was there, the doctor that took care of me and took me and did all the surgery on my head and saved my life.
And, Doctor, we were talking earlier how a lot of these first responders, when they go to somebody like that and they pick up the victim and take them on to the hospital, they kind of lose connection. They don't really know what happens. This is a great story how they were later connected.
Exactly. Michael's kept in contact with him, found out who he was, and kept in contact with him throughout his whole life, and was able to thank him for what he did for him. And you don't hear that very often in the medical field a lot. You see patients on a daily basis, and they'll thank you, but on the traumatic situation, on one-time exposure or one-time incident, Michael has really been good in pursuing and keeping in touch with this man, which really made a difference in his life.
It did. Okay, so 9 months in a coma.
Mm-hmm.
After a few days, you blink your eyes, so they decide to keep you on, right? When he came to you, what was his state when he arrived at your office?
Well, he was in a wheelchair, had very poor muscle control, had some speech ability, but it was really very hesitant, difficulty with recall in some areas, finding the right words and so forth. And so we outlined a program for him in doing hyperbaric treatment. And hyperbaric treatment's where a person is placed in a chamber. You can see out of it. You breathe 100% oxygen in that chamber. that saturates your body 10 to 15 times the normal amount. Normally, hemoglobin, the red blood cell, carries oxygen. When you put you in the chamber and pressurize it, then you saturate the whole blood vessel. All the serum in there is saturated, so you get that increased delivery. With that, then cells that have been damaged heal. It creates new blood vessels. So we use it in like diabetic wounds is one way it's used. In the trauma ways, it helps decrease swelling, helps get new blood vessels to those damaged cells, and helps those cells then heal. So like in a stroke, you'll have a central area that's dead, and then the surrounding area has just been damaged. Those cells are idle, they call them. It wakes those cells up. And so
It wakes the cells up.
Wakes the cells up. So that's what we were working with him. We initially did 40 hours of hyperbaric, an hour twice a day or an hour daily, whichever he could tolerate at that point. After initial 40 hours, we saw that he had some improvement in his muscle control, in his speech. And so totally he's done about 120 hours now.
Wow. And as his wife, I imagine you've seen a big improvement, probably ongoing, as it's always getting better.
Yes, he's always getting better. We still have basic, movement issues, mainly balance. He walks with a cane.
Sure.
He's forgetful sometimes, but I mean, for the most part, we live a pretty normal life. But I mean, we just bought a house. He got an instant family with 3 boys, so we just have a normal life.
But it wasn't like that before, and I really want to kind of go through, and this, you've seen this a lot with this type of technology, this hyperbaric chamber, that it can restore people their physical mobility, but then your mental capacity as well. As you said, he had difficulty finding the right things to say, which, trust me, Michael, I go through that too. Trust me, every single day. But this technology is out there for people that perhaps have suffered the same things that Michael went through.
Exactly. And the technology has been around for a long time. Back in the 60s is when it really started to be used in the medical field. Before then, it had been used in some experimental areas. They have always used it for the bends and diving, so that when you get nitrogen bubbles from ascending too fast from scuba diving, you get all kinds of central neurological and joint pains and damage if you don't get rid of that quickly. So they've used it for that. But with new technology, it's used worldwide. So there's worldwide literature on its uses and benefits, more coming out monthly on its uses. Recently, there's been some new articles on hyperbaric and concussion, and really speeding up the recovery on concussions from where it's been an average of 17 days or so to recover. Now it's down to 3 or 4 or 5 days with the use of hyperbaric.
Michael, let's talk about what you've done to kind of move forward with your life. And I think you have a new purpose now. Yeah. Let's talk about your website.
Well, I got it's called Trimunity. It's for injured people, but mainly brain injured people. But if you have any injury, you could sign on and get help with it. And I just give advice and what I did, just share my information, how good I'm doing now. And it is possible. You never fail until you stop trying.
There you go. You're definitely a walking testament to that. What are some of the things that people ask you? If you can, what are some of the injuries that people say that they've had?
Well, there's just about everything. Stroke, cancer, to traumatic brain injury, to just regular brain injuries.
Do you suggest people use hyperbaric?
Well, I put in there all the time that I did hyperbaric, and it's what helped me.
I'm just wondering if some of the feedback that he gets, that these people, I want them to take the advice. Do they take the advice?
I don't know, because there's been like 1 or 2 people that have said they've done it, and it really helped them a lot too.
Let's talk about what it's like to be in a hyperbaric chamber. I got to tell you, I'm a little claustrophobic. But that's not necessarily the case, right? You were telling me there's like a dadgum TV in this thing, right?
Well, the TV is outside because when you're pressurized with 100% oxygen,
It's hard to put in
you can blow yourself up with an electrical spark.
Yeah, I got you. Well, that's a good point.
So you don't want, but there is TV. You watch TV. It's a whole acrylic cylinder, and so you see out all the way around you. So it doesn't feel like you're enclosed in a tube.
I got you.
You do have the sensation of being pressurized, like descending in an airplane where you have to clear your ears because the pressure changes. But otherwise, it's really comfortable. A lot of people sleep in there. They watch movies, listen to music that's through special speakers that are all specially designed for this environment.
Yeah. And it's about an hour, right? Treatment?
Yes.
Yeah. And I guess the number of treatments varies that you, as far as how severe your injury would be, I would imagine, right?
It does. Typically, when you're trying to really create healing, it takes a while to get the new blood vessels going, the cells going. So usually when you have traumatic brain injury, strokes, it's around 40 hours of treatment that it takes to get you to the point where you really can see some benefit. Now, there's other things where it may be much shorter term. So like acute carbon monoxide poisoning, that you get reversal right away because you're changing an acute situation with 100% oxygen, oxygenating all the tissues in your body and get rid of the carbon monoxide. So that's right away. So there's things that occur really quickly, and then there's others that's more in a rehabilitation aspect. I explain it to people like you are going to the gym, you want to strengthen your muscles, you want to get your brain working better, you got to work with it over a period of time.
Dr. Al Johnson of the Johnson Medical Associates, located right here in Richardson, beautiful Richardson. Michael and Kara Black joining me as well. We'll take a break, come back. Let's talk about where you might go from here. Like I think your bigger purpose is ahead, and I noticed a cross around your neck. We'll talk about that as well. We go into this Thursday edition of In the Know. Stick around.
620 AM, KEXB, experts in business in North Texas.
All right, welcome back. 3:32 on this Thursday. We are in the studio, Dr. Al Johnson of the Johnson Medical Associates and Michael and Kara Black as well. Michael was involved in an accident years ago, spent about 9 months in a coma, made his way out and made his way over to a hyperbaric chamber. And that's where he was worked on by Dr. Al Johnson. Let's go real quickly in the break. We're talking about the types of, I guess, what does it cost? Like, in other words, does insurance pick up? So I know insurance covers certain things in regards to hyperbaric.
Yes, there's approved indications for it, and then there's off-label indications that have been used worldwide, many articles published. The approved indications are like 14 different ones. Many of those include diabetic wounds, non-healing diabetic wounds. Sometimes insurance will cover wounds that are non-healing to help healing occur faster. Also, they typically approve hyperbaric for acute vision loss, where you get artery occlusion, acute hearing loss, where there's the nerves affected to the ear, and so it helps with that and can improve that. Bone necrosis secondary to radiation, so like you have cancer in the jaw, or they radiate your jaw for some tumor. Also for osteomyelitis. So if you have bone infection and it's not getting better, then hyperbaric helps with that. For people with fungal infections, they'll pay for fungal infections that are systemic. There's good articles supporting the use of hyperbaric with that when there's immune-compromised individuals.
Let's talk about his double vision. I know in the break he had saw a picture on the website. You want to talk a little bit about that?
I had very bad double vision after my accident. I was wearing glasses, prism glasses for my vision, and every time I would take them off because you got to take them off to go in the hyperbaric chamber. Take them off, and then after like I don't know, like 4 or 5 weeks. I took them off, went in the chamber. I came out, I was like, I can see now.
I can see. That's a nice benefit from it, right?
Yeah.
Oh, exactly. And you have vision changes with strokes. You have vision changes with traumatic brain injury, and you heal that part of the brain that controls your vision. Your vision improves, just as you experienced, Michael. That yeah. In the same way, I see now with people with central brain damage, whether it's encephalitis that occurs with that, or with other types of brain situations, trauma.
Yeah.
Exactly.
You know, and being the fact that you were in a coma for 9 months, it's a long time.
It is
right?
a long time.
And it wasn't until you blinked your eye later on that someone said, "Wait a minute, let's see where this develops." Obviously, this would probably, doctor, would be the stupidest question I would ask today. Is you don't remember being in a coma, obviously, right?
No.
I noticed a cross around your neck.
Yes, sir.
Christian.
Yes.
Has this deepened your faith as a Christian? Yes.
It has, because if God didn't want me here, I would have died. But there's a purpose for me here, so yeah.
No, I'm with you on that. And Kara, you probably have the same.
Yeah, I mean, I definitely, that's a huge, faith is a huge part of both of our lives. So, I mean, with everything we do, but we have tremendous amounts of faith, specifically because of the situation.
Go ahead.
Well, just with everything, and like from the big things to the little things, like him getting out of a wheelchair onto a cane. He can walk without a cane. He just has balance problems, but I mean, he could eventually be. We have faith in that he would be able to move forward with that. His website. He helps people that have all these, he helps give those people faith, because some of those people, I'll read through it and they're just at the bottom of the barrel where they're just like ready to give up. And he has the faith, because he's experienced it, to share with these other people that have gone through the same or very similar, situations.
One of my biggest things is you never fail until you give up.
Yeah. And he never gave up. He never gave up, doctor, at all. And of course, now you're continuing to do hyperbaric sessions now?
No,
we still
not these. Not.
We're pretty much.
Well, he hasn't done any in the last couple of years. Part of it was because he just didn't have transportation to get down, and that. And we were talking about that today. That it makes sense now that he's married and has good support, and that it makes sense to see what more we can gain from it, because typically with like brain injuries and stroke, what you gain you maintain, so you maintain those levels. If you have a degenerative disease, then you got to get the degenerative disease stopped and then work on it. But stroke and head injuries, he's done well, and I think that there can be more to be achieved.
Well, it's a great story. I mean, it makes for inspiration and hope, and God bless that first responder for getting there when he did, because he saved your life, and then you were able to meet him as he lost his life, which is something. And you told me earlier he said something very special that really kind of surprises us all about.
He said, "Thank." I went and said thank you. He said, "No, thank you," because nobody that I helped save ever say thanks.
He actually, JP did. He also shared with us when he was dying that even after he had to retire because he was losing his life, that his call all over the state of Florida is a training call that they would call JP on, to ask questions about his situation with the car accident. So he said it was, is a life changer for him, and that he gained a friend out of it.
Absolutely. For more information about this story and I guess other ways you can utilize a hyperbaric chamber, go to Hyperbaric Centers of Texas. Hyperbaric Centers of Texas.com is a website. Go check it out. I'm on it, looking around different services, different benefits in the process of going through going through this, if you find yourself or someone in your life needs some attention in that regards, it's all right there at Hyperbaric Centers of Texas.com. Well, I certainly appreciate your time today.
Well, thank you.
Thank you for coming in. I appreciate it.
Thank you so much.
All right, we'll take a break. Come back. If you want to sell your company, well, we have one way to do it. We'll get you prepared for the next phase of your life. Also coming up in the 4 o'clock hour, the best companies to work for in regards to pay. We'll do that in the 4 o'clock hour. Stick around.
Your experts in business throughout North Texas. 620 AM KEXB.
620 KEXB, a few minutes shy of 4 o'clock.